There's a sentence I hear often in my practice: "Doctor, I had filler done, but I don't recognize myself anymore." That sentence perfectly sums up what's happened in recent years. The idea that rejuvenation means filling. But that's not true. Aesthetic medicine has evolved, and so has the meaning of filler. Hi, I'm Dr. Thalia Rossi, a longevity doctor and aesthetic doctor. For me, aesthetic medicine is never just an isolated act. It's part of a broader journey, a journey of longevity that connects body, mind, and skin, because your skin reflects everything happening inside you. When we restore inner balance, the skin naturally starts working better, and in that balance, filler isn't about changing your face, it's about preserving its vitality over time. Many people think a filler is simply something that feels. Well, yes, it's true, but in reality, it's a biocompatible substance that integrates into your tissue. The most common is hyaluronic acid, a natural molecule we all have in our skin, luckily, that hydrates, tones, and supports. Not all hyaluronic acid fillers are the same. They differ in rheology, how the gel behaves physically, how dense, how elastic, how resistant or adaptable it is to movement. These properties depend on factors like cross-linking, viscosity, elasticity, in other words, how the filler behaves once it's under your skin. There are fillers that are structured and firm, ideal for adding volume or support, like the cheekbones or jawline. Medium elastic, perfect for redefining contours while keeping the movement natural. And soft, lightweight fillers, used for delicate areas like the lips, under the eyes, or to improve just the skin quality. When the right filler is chosen for the right area, it blends seamlessly, moves with your expressions, and becomes invisible both to the eye and to the touch. That's why the choice of product is never random. The wrong filler in the right place can ruin a result, but the right filler placed correctly can rejuvenate without ever betraying natural beauty. Then we have newer, more regenerative fillers like carboxymethyl cellulose, which doesn't add volume but improves skin texture by stimulating new collagen. And there are biostimulatory fillers like calcium hydroxyapatite, polyallolactic acid, and polycaprolactone. They work by encouraging your cells to produce collagen and regenerate over time. Each one has a specific role, and choosing wisely is the key to natural result. In recent years, another category has been growing fast: autologous fillers, products made from your own body. The best known is lipofilling, where your purified fat is reinjected into areas that have lost tone or volume. There are also blood-derived options like PRP and PRF, which use your body's own growth factors to stimulate regeneration. They are completely biocompatible because they come from you, and they reactivate skin vitality in a natural, progressive way. It's worth remembering how far aesthetic medicine has come. In the past, substances like liquid silicone or paraffin oil were injected, materials we now know were dangerous. They could migrate, cause infections, granulomas, or permanent deformities. Today, those materials are banned, and we work only with safe, absorbable, CE certified fillers that respect the biology of the skin and integrate naturally into its metabolism, because safety is never just an aesthetic detail, it's the foundation of trust. So the new approach is to harmonize, not transform. The real difference today isn't in the products, it's in how it's used. You don't need much filler to look beautiful. You need the right filler in the right place. We work delicately following anatomical planes, respecting the dynamics of the face, because your skin must continue to move, express, and live. A beautiful face shouldn't look filled. It should simply look alive. Let's talk about risk and side effects, what you should know. Like any medical procedure, fillers come with possible risks. Too much hyaluronic acid or injection in the wrong plane can cause migration or asymmetry. Common side effects include redness, swelling, or small bruises. Just, consider them when you do it. They usually fade within a few days. But there are also rarer, more serious complications like vascular occlusion or infection that requires skill and quick action. And sometimes granulomas or nodules may form, foreign body reactions that are preventable only with safe materials and proper technique. That's why fillers must always be performed by a qualified medical doctor, someone who understands anatomy, injection planes, and uses certified products. In my clinic, I only use approved fillers. Before every treatment, I perform a detailed skin assessment, and when needed, I recommend facial ultrasound to ensure maximum safety. That's the difference between doing aesthetics and doing aesthetic medicine. There are 3 golden rules for good filler practice. 1. Personalization. Every face is unique. Proportions must be respected. 2. Moderation. Less is more. Subtle, progressive touch-ups keep results natural and safer. 3. Integration. Fillers work best when your skin is healthy. Hormones, nutrition, sleep, and stress all influence how your skin behaves. That's why longevity is so important. When your body is in balance, just a little is enough to achieve an elegant, long-lasting result. Modern aesthetic medicine isn't about erasing time, it's about aging well. Having radiant, elastic skin and a face that continues to tell your story authentically. When used correctly, filler isn't about changing who you are, it's about maintaining what's already beautiful, healthy, and alive. True beauty doesn't come from what we add, but from what we reactivate. The right filler at the right time doesn't change a face, it accompanies it through time. That's the difference between filling and regenerating, between corrective and regenerative aesthetics. Beauty doesn't come from a product, it comes from a coherence. A well-executed filler is an act of care, not vanity. On my channel, you'll find more videos about skin longevity, dermal biostimulation, and how to choose the most effective active ingredients for your skin. Activate the bell and subscribe to my YouTube channel to explore how to live better, longer, and with skin that reflects health, balance, and vitality. You can also visit my website to read my articles on aesthetic medicine, longevity, medical innovation, and conscious biohacking. And if you'd like a personalized plan, feel free to reach out. I'll help you design an aesthetic and longevity path truly tailored to you, from the surface all the way down to your cells. See you in the next video.